All right. Thank you for joining us today for the American Heart Association's Understanding the Issue of High Blood Pressure community conversation featuring Dr. Robert Groves and brought to you by Banner Aetna. My name is Corinne Kleinschmidt, and I am the Vice President of Health for the Greater Phoenix American Heart Association, and we're very excited to bring you this digital experience via Zoom today. Before we get started, there are a few housekeeping things I would like to take care of. First, as you heard when you came on, we are recording this session so that it's available for you afterwards. At the end of the event, you will receive an email with a copy of the presentation slides and a link to the recording. So while I'd love for you to be taking notes during the presentation and Dr. Groves is speaking, if you do miss something, don't worry, we will have the slides and the link for you after the webinar. For those who might be unfamiliar with Zoom or using it for the first time, I'm going to take a quick moment to go over a couple tips to help you so you can participate and ask questions during the session. When you joined, you're given the main event window. If you click chat, you can have the chat window added to your view. The slide that's up right now shows a picture of what that would look like. If you want to remove the chat window, then you just click chat again so that it will be removed. And when you do have the chat window open, you can type in responses and questions. You can choose who you want to message. We recommend you select all panelists and attendees so that it goes to everyone. This is good for then we can get back to you quickly for your questions and your comments. So let's test what we have just learned with our chat box. Open your chat box and type in the answer to this question. What is one thing that raises your blood pressure? I see some posts. Salt, stress, children, yes, I think that relates to the stress side right there. Here in the pandemic, spending a lot of time with our husbands, yeah, sometimes they can help relieve the stress and sometimes they add to it, right? Yes, smoking, dehydration, weight. Parents, I think that goes back to the stress. As we can see, we've got a lot of great ideas here, and these are definitely things that add to our high blood pressure. And the great thing is Dr. Rose is going to go over more of some of these things and what we can do to maybe reduce some of that high blood pressure that's getting caused. As we do get started, I want to give special thanks to our sponsor, Banner Aetna, for making the event possible. We're very excited to work with them to provide this invaluable blood pressure information. Banner Aetna is an Arizona health insurance company that leverages the strengths of two of the largest healthcare organizations in Arizona, Banner Health and Aetna. So thank you, Banner Aetna, for your support. Today, it is my pleasure to welcome Dr. Robert Groves, the Executive Vice President and Chief Medical Officer for Banner Aetna. In his current role, Dr. Groves is responsible for population health management. He received his MD from the Medical College of Georgia and previously served as the Chief Medical Officer for Banner Health Network. Today, he's going to explain what blood pressure is, why it needs to be kept below 120/80, and then how we can get there. Dr. Groves?
There, can you hear me now?
Yes, we can hear you now.
Sorry
Perfect.
about that. I was immediately challenged to get off. Welcome, everybody. I'm glad you're here, and we are here to talk about blood pressure. And I think sometimes blood pressure is overlooked because it is so silent. But take a look at this slide. This is the stadium where many of you may have watched your home team play, the Cardinals. And this is State Farm Stadium. About 1 in 2 adults in the United States has high blood pressure. Yeah, I mean, 50% of us have this. And less than half of those have actually had it diagnosed. Now, if you look at America's health rankings, about 33% of adults in Arizona have been diagnosed with hypertension. Now, what does that amount to? Well, that's, first of all, more than the national average. And that's about 1.1 million people. And that's enough to fill this stadium 17 times. Or if you want a different measure, that's the population of Mesa and Tucson combined. Now, of those who know that they have high blood pressure, those 33%, if you will, only about 44%, so significantly less than half, actually have it controlled. Now, blood pressure control was improving between 2000 and 2010, but since then we've had some problems. It's been declining. And all this despite easier access to medications and better treatment regimens with fewer side effects. So it is something that we want to get out there. This is important, and we want people to know about it so that they can follow through. It's an epidemic for the community, but it does impact some communities more than others. Let's take the next slide, please. The frightening thing about hypertension or high blood pressure, you can hear it said both ways, is that folks that have it think they're doing just fine. There aren't any real symptoms, particularly early on during the disease. And that damage that's being done early in the disease, much of it is not reversible. So it's important to find out as soon as you can. And it impacts some communities more than others. As you can see on the slide, 1 in 2 African Americans, 1 in 5 Asians, 1 in 3 Hispanics, Latinos, 1 in 4 American Indians. But the most troubling piece of this slide is 1 in 6 children in the United States has high blood pressure. Now, hypertension leads to much more serious illness like heart disease and stroke. Now, these negatively impact our lives, obviously, but the statistic on children is particularly troubling. And I don't know if you knew this, but it is predicted now that this generation of children will actually not live as long as their parents. And to me, that's something that we have got to change. That just doesn't make sense. So let's look at some facts about high blood pressure so that you know enough to begin understanding what you can do to address this problem. Now, the next slide, a nice little schematic here. What is high blood pressure? Well, when your heart beats, the heartbeat itself is a series of actions, 2 of them that are critical. The heart squeezes and it relaxes. This is not hard to understand, obviously, but when the heart squeezes, what it's doing is it's sending blood, oxygen-rich blood, throughout the body to feed all of our cells. And there's also nutrients in there and enzymes and lots of things that are critical to the function of every cell in the body. And that blood needs to get everywhere, and it needs to get there quickly and efficiently. And that's what your heart does. And when it squeezes down, that's what's called the systolic function of the heart. And when it relaxes, that's called diastolic. So systolic and diastolic. And typically, when you get a blood pressure reading, you'll get 2 numbers, and that's what they represent. The top number is when the heart squeezes. It's high pressure to get all of that blood out to every cell in the body. That's your systolic pressure. And then the bottom number is when that heart completely relaxes, the pressure when the heart is relaxed. And so you'll typically see it reported as 117/76, et cetera. So that's the function. That's what happens here. Now, we're going to take a quick poll. It's easy to spot someone with high blood pressure. And I'll give you a couple of seconds here to answer this question. True or false? Well, I hope that most of you got this one right, because hypertension or high blood pressure is one of those diseases that's very, very hard to notice if you have it or if someone else has it. There aren't really any symptoms that you can point to. Most of the time, it is not obvious. Now, again, we go back to the blood pressure tells us how hard the heart is working to pump blood throughout the body. And so it stretches the blood vessels, and if you have hypertension, it stretches it too far. And so what happens over time is you get tiny little tears. And when you're born, all of those blood vessels are so elastic and they distend easily and they relax nicely. And it's like a nice elastic hose, if you will, throughout the body. Over time, as you begin to tear that hose with higher than normal pressures, then there's repair done and it scars down. And the spackle is, if you can think about it, is cholesterol. And over time, this can lead to blood vessels that are stiffer and less compliant. And that tends to increase the blood pressure further. And those cholesterol spackle, those spots of scarring, can cause further buildup, and that can lead to actual blockages in the blood vessels. And those blood vessels are feeding critical organs. That's the part that you need to pay attention to. Blood isn't getting to all the tissues that need it. And there are some organs in our body that are really sensitive to that, like the heart. Heart attacks are literally a blockage in the arteries that feed the heart muscle itself. High blood pressure is dangerous because it can also lead to stroke. That's when it blocks the blood vessels that are feeding your brain. But it can happen to any organ in the body. It can happen to the kidneys, to your eyes, and ultimately over time, you're also causing your heart to work much harder than it needs to. And that can lead to something called heart failure, when the heart simply isn't strong enough to do the job that it was designed to do, which is to get that oxygen-rich blood to every single cell in your body quickly. Now let's look at the categories of blood pressure. So how do we define high blood pressure? I want you to pay special attention to the third column over, and whether it's an and or an or, because that does become important. So a normal blood pressure is when your blood pressure is less than 120 over 80. It's elevated when that top number goes above 120. And it's only elevated if that number on the bottom stays less than 80. Once that number on the bottom is over 80, you've got stage 1 hypertension. So pay attention to that. Even the top number going up a little bit is an elevated blood pressure. That's when we need to start paying attention and doing the things that can help us address it. If you get to stage 1, that's when it's between 130 and 139, or that bottom number is 80 to 89. And then hypertension stage 2, 140 or higher, or 90 or higher. Now, I want to spend just a moment on hypertensive crisis. If you get good at measuring your own blood pressure at home, and you find that your blood pressure is higher than 180 over 120, that really is an emergency. Wait 5 minutes, check it again, make sure it's accurate. But if that number is still up, you need to call somebody immediately, because that is a level of hypertension that does immediate damage to the organs. There is serious risk. You may have chest pain or shortness of breath or back pain or numbness or weakness, changes in vision, difficulty speaking. This is a hypertensive crisis and you need to pay attention to it. Now let's back up for a second. When the blood pressure is consistently ranging from 130 to 139 or 80 to 89 diastolic, at this stage, most docs are going to say, okay, let's try some changes in your lifestyle. Let's do some things that might help get that blood pressure down and avoid needing to put you on medications. Now, if you have other risk factors, you're diabetic, or you have some pre-existing kidney condition, et cetera, they may opt to go to medication sooner. But at this level, we want the opportunity to respond to lifestyle changes if you don't have any other risk factors. Once you get to stage 2, though, which is that 140 or not 140 over 90 or higher, once you get to stage 2, most physicians are going to say, let's start you on some medication. And I want to tell you, it's so much easier today to treat high blood pressure than it's been in the past, because we've learned how to use combination medications, so we don't have to go to really high doses on a single medication, and that reduces the number of side effects and makes us more likely to comply with the recommendations of our physicians. Okay, let's go to the next slide now. And this is what I was trying to point out earlier. Hypertension, because it is a disease that affects every artery in the body, every cell in the body is at risk. Now, there are certain organs that are at particular risk because they depend on a great blood flow. Kidneys have a very delicate membrane that's used to filter blood. And you start doing damage to the vessels that feed the kidneys, you can run into problems. Vision loss is not uncommon with hypertension because, again, there are lots of little delicate vessels that are feeding that eye, and it is required for you to have that sharp vision that we all cherish. The other organ, well, sexual dysfunction, erectile dysfunction is common in folks with long-standing hypertension, and it can also lead to reduced libido in women. So again, areas of the body that can be affected. Everybody is familiar with angina, chest pain with exertion, and that signal, that chest pain, is telling us basically that we're not getting enough blood to the actual muscle of the heart. And it can affect the peripheral arteries as well. Some people have cramping in their calves with walking that's reproducible, and you can get that tested to see if that is a problem for you in particular. But It's the same process that's happening all over the body. And then the big three that we are all familiar with, I hope by now: heart attack, heart failure, and stroke, consequences of long-term untreated hypertension. Now let's go to the next slide. Now, we're going to look at a quick video that is a testimony to how dangerous high blood pressure can be. And let's learn some more about how to reduce your risk of suffering the consequences of hypertension.
180 over 111, and I had a stroke. I was diagnosed with high blood pressure 12 years ago. I had 6 mini strokes in the hospital, and I had a severe stroke 8 months later. That day was terrible. I passed out, and that's what I remember, passing out. When I woke up, I couldn't speak or walk. I felt trapped inside myself because I could think. I am an attorney, and I can't go into the courtroom because I think that most people don't find me intelligent. They tend to finish my sentences. And that's what I want to do. You have to be an advocate for your health, because if you don't take care of yourself, this is what will happen.
And what do you think that that young lady would give to go back in time and have a chance to reduce her risk of that happening to her? This is real, and we need to pay attention to it. And anything above 130 over 80 is high risk. Most heart attacks and strokes happen in folks that have a blood pressure over that level. And we don't know the main cause. We call it essential hypertension. But typically, you're not going to feel anything. You won't know unless you check it. It is a serious disease because every time your blood pressure goes up, even a little bit, 20 over 10, the top number goes up by 20, the bottom number goes up by 10, it actually doubles your risk of heart disease. Still the #1 killer in the United States. So let's talk about what puts you at risk for hypertension. Well, certainly family history can put you at risk, but it's not a given that if you have a family history that you're going to get it. There are lifestyle interventions that you can do that are controllable, that are up to you, that can reduce your risk even if you have a family history. But certainly it's a marker and it's something to pay attention to. Age can play a role. The natural, stretchy, resilient arteries that we have when we're kids, over time, those naturally develop increased stiffness. And it's interesting that up to the age 65, hypertension is more common in men. After 65, it starts to be more common in women. And race plays a role. In fact, we know that it is much more common in multicultural communities, and those who may not have as good access to healthcare. It's a national problem that we need to address, and we need to get the word out that this silent killer needs to be recognized, and it needs to be treated with a lot of respect. And there are things that we can do to make it better. So what kinds of modifiable risk factors are there? Well, there are a lot of things that you can do to change your risk of both developing high blood pressure, and even with the early stages of hypertension, sometimes they can be, or it can be absolutely reversed with lifestyle changes. And one of the major issues is getting physical activity. Now, if you haven't done a lot of physical activity recently, it's probably a good idea to check with your physician to determine how much you can tolerate. But getting a start on that, even walking regularly, is a great way to lower your risk of developing and to improve your chances of managing high blood pressure. Diet plays a critical role. I don't know how many of you have heard of the DASH diet, but that is a diet that is specifically designed to address the risks of high blood pressure. There are lots of unhealthy ingredients, particularly in processed foods. They tend to be very high in sodium. They tend to have other ingredients like trans fats that make them especially unhealthy. High sugar intake also seems to lead to an increased risk of high blood pressure, and it leads to the problem of overweight or obesity. And if you're carrying all that extra weight around, you're carrying an extra strain on your heart and your circulatory system. And by the way, obesity is associated with increased risks of diabetes as well. And so that's a double whammy, and something that we want to do our best to try and reduce and control. Drinking too much alcohol can cause a problem in driving blood pressure up. We do know that mild or moderate alcohol intake is okay, but once you go past that, a number of risk factors go up, and hypertension is one of them. Certainly alcoholism, suicide risk increases with high alcohol intake. There are a number of issues that are associated with that particularly during this time of the pandemic, we want to keep a careful eye on that and make sure that we're not going overboard. There's something called sleep apnea. I think most people are somewhat familiar with that now. You'll see it in folks that, first of all, the risk factors include being overweight, and folks with sleep apnea tend to snore a lot. And if they have someone who sleeps with them, a partner, they will notice that they seem to stop breathing, and then that's followed by loud snoring. And sleep apnea over time increases the risk of hypertension as well. High cholesterol certainly is a risk factor, as is diabetes. And I hope everyone on this call now knows that smoking is a major risk factor, not only for hypertension, but for damaging the blood vessels, leading to heart disease, leading to lung disease. We know that smoking is one of the most toxic things that we can do to our body. And so obviously if you smoke, then seek out help to see if you can find a way to quit. And then stress. Stress can be both good and bad, but when stress overwhelms us, when we don't have the resources to cope with it, then that can lead to the same kinds of issues, the release of fight or flight hormones, if you will, that lead to higher risk of hypertension and higher risk of other problems related to heart disease. Let's go to the next slide. Now, if you try those lifestyle changes, if you're in that early group where your blood pressure is elevated or you have stage 1 disease and you've tried those interventions and they don't work, or even if you're in those lower levels and you have another risk factor like diabetes or kidney disease, you may be prescribed medication. Now, it's important that if you're above 130/80 and you are prescribed medication, that you take it as directed. If it's not working for you because of side effects, etc., don't stop it on your own. Call your provider, call your doctor, and get some advice on where to go from here. There are lots of options in treating high blood pressure, so don't go without. And even if you find that your blood pressure is now controlled, don't stop your medication, because that's part of the control. If you think that you can reduce it, again, talk with your physician. I mentioned earlier that it's become easier to treat hypertension with fewer side effects. And one of the things we've learned about that is that if we use more than one medication, we can often use lower doses and therefore have fewer side effects. So don't be surprised if your physician has you on multiple pills to treat hypertension. Let's go to the next slide. One of the things that's really cool, when I was first starting out my practice, these kinds of things didn't exist, at least not in large numbers, easily accessible and easy to use, but you can check your own blood pressure. And that is really useful, because having it checked twice a year at the doctor's office really doesn't give us a good idea of what the usual blood pressure is for you. And you can document those numbers, maybe check it morning and evening, and you can bring that to your physician, and you'll have a much better idea of what your blood pressure is over time, whether it's controlled, and what you need to do to make it better. These devices are not hard to use. You can find them at any pharmacy. We certainly recommend that you get a device that is approved, but most of them for sale at pharmacies now are. The American Heart Association has tools to help you get familiar with that and get comfortable with that. Now let's look at a quick video that gives more information on how to use those blood pressure monitors to measure your blood pressure at home.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at high risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with an upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your two measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
All right. Now it's time for another quick poll. Which of the following is not a best practice to get an accurate blood pressure reading? Well, I hope most of you got this one. For those of you that are still puzzling away, it's the bottom one. All of the above are best practices to get an accurate blood pressure reading. You know, I'm doing pretty well there. Doing pretty well there. Relaxing is really important, and people skip that step a lot. So I would encourage you to do that. I know that's not easy necessarily if you have kids at home to find 5 minutes to sit in a chair and relax, but find it if you can. Avoiding caffeine, exercise, and tobacco at least a half an hour before. All of those are great ways to make sure that you get an accurate blood pressure. I want to talk a little bit about resources that are available to you right now. you can assess your risk factors and get your health score at AHA's free online heart health assessment. That's at mylifecheck.org. You can also learn more about monitoring and managing your blood pressure at manageyourbp.org. And also you can learn about high blood pressure and heart disease and stroke at loweryourhbp.org. I want to make one final comment before we leave, and that is that, you know, it's always better to prevent or to manage with lifestyle changes if we can. It's always better than trying to treat it after the fact. So I would encourage you to learn as much as you can about what you can do in changing your lifestyle, whether it's exercise, stress management, getting enough sleep is critically important. Diet is critically important. Those are the big four. Learn as much as you can about what you can do in those areas. And if you don't want to do it for yourself, think about that 1 in 6 kids now that are developing hypertension. What about modeling for the next generation? We don't want to have to keep saying that the next generation is expected not to live as long as the current generation. So I'm going to leave you with that. I'm going to turn it back over to Corinne to keep us moving along here.
Thank you so much, Dr. Groves. We really appreciate you taking the time to share this invaluable information with us. And on behalf of Banner Aetna and the American Heart Association, I hope everyone today found the information beneficial and that you can take some action to share what you've learned. We do have time for questions, and I have been keeping log of them. There are a lot of questions, Dr. Groves, so I hope you're ready. So we're going to start with the ones submitted during the presentation, and as you have follow-ups, please keep typing them in, and I'll keep track of those. The first question we had was, how are the blood pressure numbers and categories determined? I mean, everyone is different. Do they really apply to everyone?
That's a great question. The short answer is that as far as we can tell, yeah, they do. There are certain populations that are at higher risk for developing problems related to hypertension. And there was a recent update. I don't know if all of you are familiar with that, but there was a recent update to the numbers. And the reason that happened is because the problem's not getting better. And so when we look at the risk of developing heart disease and stroke and kidney disease and the other problems that I discussed, it starts to go up pretty early. And you saw that 130/80. Now, as a physician, I might recommend an aggressive trial of lifestyle changes at those levels, because as I mentioned, I'd much rather prevent a problem than add a medication or a drug to treat a problem. But there are no populations that tolerate blood pressure measurements above that really well. Now, there's one exception. For those who have had hypertension for a long time, there can be problems with getting that blood pressure too low. And so in those circumstances, if you're, in your 60s, et cetera, and you've not treated it well in the past, or it's a problem that crept up on you, whatever the situation may be, then it's a good idea to talk with your doc about the specifics. And as is the case with any of these recommendations, this needs to be tailored to you based on a relationship with a physician. When we're doing one-offs, you break an arm or something, you get that repaired, you don't necessarily need to have a relationship to do that, those acute services. But when we're talking about long-term chronic diseases, it really does help to have a touch point where you're, somebody somebody you trust, who can help guide you in the specifics. And that's where the detail comes in. You may have heard it described in business circles as mass customization. That's really what we're talking about. Certainly those guidelines apply, but there are caveats with each individual, and that's what the physician-patient relationship is designed to address.
So, which relates to the next question of, could stage 1 or 2 be considered normal for some people? Because as you mentioned, people are different, but it really is that relationship with their doctor.
Yeah, I think that's something you want to take up with your physician. And normal is a broad term. I would not consider it necessarily normal. But I might tolerate that if it were balanced against other risks. I mean, there are always risks that we think about in medicine. And the question becomes, is the risk of treating this, does it outweigh, does the benefit of treating this outweigh the risk of not treating it? That's the equation that you have to get to. And that's when you need to talk to your healthcare provider, your physician.
They also want to know, can a patient become acclimated to a specific hypertension drug and then require them to increase that dosage or to switch to a different drug?
You know, people vary a lot in their response to medications, and can you become resistant to a specific drug? Well, hypertension is a disease that if the underlying risks or whatever driving it are not corrected and you're simply treating it with medication, it is likely that it will get worse over time, frankly. And in that case, yes, you may need to either add another drug or change drugs. And there are lots of options out there today that make it fairly easy to get there without intolerable side effects. If you're having side effects from medications prescribed for hypertension, the best thing to do is, again, talk with the doc and say, you know, I don't tolerate this drug, and here's why, or here's the symptoms I'm having. Could this be related to this drug that I'm taking? And most people can find a regimen that both gets their blood pressure to the level that your doc wants, while at the same time avoiding intolerable side effects.
I'll say a nice logistics question. What arm should we use, our left or our right, when we're measuring our at home?
Wow, that's a great question. I don't think it makes any difference, frankly. I think it depends on how easy it is for you to access that arm. There are certain diseases where there's obstruction to one side or the other. And so it might be useful to try it on both sides and see if there's a difference. If there's a big difference, that's something you ought to tell your doc about, because there may be an obstruction on one side or the other. But in terms of measuring blood pressure over time, what I do not recommend is there are some cuffs out there that measure at the wrist. I'm not confident that those are accurate over time. So I would recommend that you use a blood pressure cuff that fits the upper arm. And you need to make sure that it fits the upper arm properly. If you've got a very big upper arm or a very small upper arm, you know, it might be worth having a chat with the pharmacist where you pick this up, or with your doctor to make sure that the cuff fits your arm correctly, because you can get bad numbers, if you will, if you have the wrong size cuff.
I say, and thank you for mentioning that. Someone had asked about the wrist cuffs, and from the AHA, we recommend the arm cuffs because the wrist cuffs are not as accurate. But again, whatever arm you pick, left or right, just make sure you're doing all the measurements on that arm, so that way you have that consistency. Someone here has a great question about how do we assist our providers to take elevated blood pressure seriously? There are a lot of them where they may not be following the new guidelines that we talked about. Yeah,
the guidelines are new, but I think one of the things you can do is use the AHA resources. I mean, there's physicians don't necessarily like to be educated by their patients, but you know what, tough, because this is something that needs to be taken seriously. And often your commitment to getting it down to the new levels will be enough to prod them along. And share with them some of the information that you've picked up today from the AHA. And it's fair to put the question directly to them. Why aren't you concerned about getting my blood pressure down into the normal range? There may be a good reason, but it's fair to ask that question. I wouldn't be afraid to do that.
Yeah. Someone else talked about, well, how do we get our doctor's office to do the blood pressure readings like we were talking about? Is it okay to mention to them, you know, as we talked about, you need to not be talking and you need to have your arm supported. The Heart Association, just so folks know, have resources for the outpatient clinic settings called Target BP, which is designed to help those professionals with what's called an M training, kind of a refresher on how to do blood pressure. You know, a lot of folks, they graduate, they know the rules, and then it's a few years later, you're going quick in the clinic. So the AHA has some tools and resources for that. But to that point, it's okay for you to say something to your doctor. And like you said, Dr. Groves, to be polite about it, but you are your advocate for your own health. So being able to ask them and say, hey, should my arm be up here when you're taking my blood pressure? Or maybe we should be talking while we're doing this.
Yeah, and the other thing that I would say is the couple of times you get your blood pressure checked in your doctor's office are probably the least important. What's really more important is learning how to check it at home so that you have a good idea of what your blood pressure actually is, and then share that information with your physician. I'm not saying it's unimportant, but there's such a thing as white coat hypertension. Some people always have a slightly elevated blood pressure when they see their physician. And frankly, that's probably in part because they sit you down or asking you 50 questions while putting the cuff on your arm, et cetera. Sure, it's fine to say something there, but learn how to measure your own blood pressure and get accurate results that way. And then you're not so dependent on what happens in that 5 minutes twice a year that you're in the doctor's office.
We have some questions about medications. There's one called amlodipine. I don't know if I'm saying that right.
Mm-hmm.
And they want to know if that causes damage to blood vessels and things like that.
I am not familiar with any data that suggests that it causes damage to blood vessels. But again, what I go back to is every decision in healthcare that includes a medication is about balancing risk. What's the risk of treating versus the risk of not treating? And you want to err on the side of minimizing the risk of long-term illness. So amlodipine is a perfectly good drug to my knowledge. And again, that's a discussion in your particular circumstance. It's a good one to have with your doc.
Yeah. Another question about medication is their current blood pressure is 131/81 with medication. So that's still above the elevated range. Is that okay?
Yeah, again, my first question back would be, are you checking it at home, and are you monitoring over time? How does it fluctuate? But that's a discussion with the doc. They may be reluctant to go up yet. They may want to see over time. Can you make some additional adjustments in lifestyle that would bring it down a little bit? I mean, you're right at the margin there. So I'm not going to, insist on absolutes here. It's a conversation and a relationship over time. Ultimately, yes, it would be better if you bring it down lower because the risk is lower for heart disease over time, but you balance that against the risk of medication and against the risk of adverse drug reactions, et cetera.
Lisinopril, is that one that you remember? Lisinopril?
Yeah. Mm-hmm.
Yeah. So looking for the best time of day to take it. That's what they were just prescribed it, and they're wondering when should they be taking it.
That's a discussion again I'd have with the doc, but my experience has been that any medication that I can take as a regular part of my morning routine, I'm much more likely to fit it into my lifestyle easily than something I have to remember to take at noon or in the evening, but that's for me. I mean, everybody's a little bit different, and some medications, it matters a lot when you take it. Others, it does not. With lisinopril, as long as it's about the same time every day, it's probably not a huge issue. But I would talk with your doc and find out what they have to say. But the real trick is to make it part of the routine so that you don't miss doses and you take it at roughly the same time each day.
Someone asked if there are specific medications for African Americans, if that's something that should be considered.
Yes, there are medications that tend to work better for the African American population. There are a variety of them, and there are a variety that don't work as well. That's something that almost every doc is well aware of in this day and age, and so it's worth having that discussion and asking that question when you see them.
Perfect. So we've been talking about high blood pressure. Now we have questions about low blood pressure. What is too low of a reading?
Yeah, and that can vary quite a bit too. I mean, certainly the definition of shock currently is when your systolic pressure is less than 90. Certainly one can go too low, but I know I've had patients that run 100/60 and feel perfectly fine. If you're asymptomatic, then, you know, it may be that you've got too large a cuff on and that you're not getting an accurate reading. But if you're asymptomatic, as long as that top number is over 90, if you're not having any problems with it, then you know, thank your lucky stars that you don't have hypertension, I guess, because over time that will serve you well.
Right. And so to that, someone's like, well, if my normal is 90s over 60s, if I have 120 over 80, does that mean now I have high blood pressure?
Well, you know, there are so many things that can impact blood pressure that I would not base any decisions on a single reading. If over time your blood pressure rises from 90 over 60 to 120 over 80, and you know, I would expect some rise with aging because, as I mentioned, the arteries get more and more stiff with age. But the population studies that have been done, we start to see a significant rise in risk above that 130 over 80 number. And so if you're under that, you're pretty okay, even if you started out at 90 over 60, at least based on what we know today about hypertension. That, you know, that can change. The literature is a moving target, but today I would not be concerned unless it's a sudden rise and there are symptoms associated with it.
Basically, they're a lucky duck.
Yes.
Start out that low.
Yeah.
For someone over 50, is 120 over 80 what is expected? Or as you mentioned, people get older, their blood pressure gets higher. Is it a higher number for folks over 50?
It is not. I mean, these apply to anyone. But as I mentioned earlier, if you've had longstanding untreated hypertension, then it's you want to have a discussion with your doc because your artery stiffness may have put you in a different category over time. But no, these numbers apply particularly to that age range. And we don't want to go overboard with it. I mean, if someone is 95, we're not going to be teaching them how to live a much longer life, probably by, you know, treating their hypertension. So it's a balance of risk again, and there are no easy answers to these questions. It's part of a full assessment of everything that's going on in a patient's life and what age they are, et cetera. But yes, blood pressure does tend to rise over time as the arteries stiffen.
Any question about blood donation? Does donating blood help with blood pressure?
To my knowledge, there's no evidence that that donating blood, your body replaces that blood volume fairly quickly. And so while you might have a temporary lowering of blood pressure, your overall level of sustained blood pressure is not going to change much based on blood donation.
And my husband donates blood all the time, and I know that if your blood pressure is too high, they will not take your blood. Yeah. So there's that there too. So if you have really high blood pressure, then you're going to be less likely that they'll take your blood for that donation.
True.
Someone asked if we will have the links for the videos shown. Yes, when we send out the slides, we'll have the slides, but we'll have the links separately as well because those are both the videos are available on YouTube. And then someone's asking about blood pressure cuffs, if they are HSA, FSA eligible without a prescription. And I know for mine they were, because I was able to get one. So I think that would be true for everybody. You can purchase one.
Yeah, you can. In fact, they're over the counter at most pharmacies. There's a whole section of blood pressure cuffs, and you know, talk with your doc if you're wondering which one to use. My experience has been, as long as you stay away from the ankle, the wrist cuffs, most of them are pretty good and give you accurate information.
Yeah, and there is a new list now for the United States of the approved cuffs as far as the ones that are calibrated. So that is an easy to find link. And most of the name brands like Omron are on that list.
Yes.
Then we have, is taking your pressure on your legs an option if your arms are healing or compromised?
You can, but there's not a one-to-one correlation in my experience, and that's you can't use a typical cuff to do that. I mean, the times when pressure is measured on the leg are in crisis, really. That's folks that are in shock for some reason or can't. I think it is probably possible to do, but I wouldn't embark on doing that myself without a lot of direction and guidance from a healthcare professional.
And what could it indicate if the lower number is in the higher range than the upper number?
That's a great question. I mean, basically what it means is there's less relaxation, if you will, of the vessels after the systolic beat. But no, the difference between the top number and the bottom number is called the pulse pressure. And there are all kinds of differential diagnoses for variations in pulse pressure, but there's also a broad range of normal. And the bottom line is if the bottom number is over 80, then there's a problem that needs probably drastic lifestyle change or medication. And if it's not, and we, it's interesting because we used to think that as folks got older that we didn't worry so much about the top number, actually, that if that top number went up, it was okay. Well, we don't think that anymore. And that's, again, because of good studies that have looked at the risk of developing worsening disease and or catastrophic things like heart attack, stroke, and kidney failure related to high blood pressure over time. So the guidelines are pretty good now, I think. Again, guidelines are always a moving target, but we have really good data indicating that these numbers make sense. The only caveat to that, frankly, is as the numbers have been lowered, I don't think that it is a great idea for everybody to just start treating in that elevated range. I think that's the time to really think seriously about lifestyle change. I think we've given lifestyle change short shrift. And as I mentioned, if you can get right diet, exercise, sleep, and stress management, you can go a long way towards preventing a whole lot of chronic disease. I think you'll be surprised too, even giving it a try for 30 days at how much you can influence that bottom and top number in blood pressure if you actually do it. And the rewards are great if you can get away with doing that. I mean, you don't have to deal with the cost of prescriptions, et cetera. But it's not a thing where you can just say, well, it's mild, let's ignore it, because you do increase your risk. Remember, every increase of 20/10 doubles your risk of heart disease, and that's still the #1 killer in the US. So that's a risk I don't want to double.
Right. Someone talked about being diagnosed with thyroid disease and now their blood pressure has gone up. Some others have mentioned too about other conditions and now their blood pressure has been impacted by that. And they were surprised that those things were connected.
Yeah, there are a number of diseases that can increase blood pressure. Certainly the thyroid is one. It tends to put you in a heightened state, if you will, and releases those mediators that tend to increase blood pressure. I mean, the classic one is something called pheochromocytoma, which is it's not a benign tumor, but it's not malignant in the sense that it takes over other organs, et cetera. But what it does is release a lot of the fight or flight hormones that increase blood pressure. If you're exercising, your blood pressure is normally going to rise. That's a normal physiologic response. And what we're really talking about here is a resting blood pressure. We want to know what it returns to. But yes, thyroid disease can do that. There are certain other diseases that can do that. We mentioned sleep apnea tends to increase blood pressure over time. Yes, there are lots of influences.
I'll say, and some of our last questions are related to if we're on medications and we've made lifestyle changes, when can we get off the medications? Is there a certain amount of time that we have to have that consistent lower blood pressure reading? How can we wean ourselves off?
Yeah, that's something that I would do under the direction of your healthcare provider, under the direction of a physician. But yeah, I mean, if you get the lifestyle right and blood pressure starts to be controlled over time, I have no problem with folks beginning to wean medications. It's not something you should do by yourself. I mean, it's something that at least should be coordinated. I'm not saying that you have to go in, but share with your doctor, hey, I've been at 120/60 for a long time now. Can I stop this one drug and see what happens? Some drugs are stoppable without consequence. Others have rebound effects. So it's something you want to talk about with your provider.
Yeah, definitely. Those are all the questions we have time for today. Thank you again, everyone, for joining us for understanding the issue of high blood pressure with Dr. Groves from Banner Aetna. After this webinar, we will send out an email that has a link to the recording, a PDF of the presentation, links to the videos we saw, as well as some blood pressure infographics, including one that is a blood pressure tracking card that you can print at home so you can write down your blood pressures. I saw someone commenting that they're going out to go buy a cuff now, so that is perfect, exactly what we're hoping. In that email, we'll also include a survey, which we want to see what you learned and also feedback on how we did. If you complete the survey, you might even win a $5 Starbucks gift card. So please take a look at that email, send it like a survey, let us know how we did. And thank you all again, and have a wonderful afternoon.
Thanks, everybody. Bye-bye.